Nigeria's effort in fighting childhood killer diseases is gaining momentum with more funding support to strengthen healthcare system across the nation. Nigeria today witnessed the launch of Gavi Health System Strengthening Grant with another over $191 million funding over the next 4 years. The grant is one of the largest ever made by Gavi and is intended to help extend the reach of the health system to 1.8 million zero-dose children and increase immunization coverage to 87% by 2028. This grant was designed by the government across Federal Ministry of Health, NPHCDA, and other agencies at the federal, state levels, and with support from WHO, UNICEF, many other partners, and civil society and private sector organizations. This in addition to investing close to $100 million this year in vaccination campaign to protect over 100 million children against measles and rubella. How does this PHCDA manage all these interventions funds? What value does it add to the healthcare system of the country, especially in the fight against childhood killer diseases? This and more would be a focus on the program, Nigeria Today. Thanks for joining us. I am Ikaria Clinton. Now, joining me in the studio to discuss strengthening primary health care in Nigeria is Dr. Emedo Emmanuel. He's a health specialist, UNICEF Nigeria. It's a pleasure to have you.
Thank you, Ikaria, for having me.
Also with us in the studio is Chika Kemi Ofo. She's from the Vaccine Network, a civil society organization. We're glad to have you on the program.
Thank you for having me.
I'll start with you, Dr. Emedo. Talk to us about this Gavi, the grant generally. What is it about? Here, this grant.
Thank you once again. As you rightly said, the grant is about, it's called Health System Strengthening Grant. It's about strengthening our Nigeria's health system to deliver basic services, the primary health care services, including immunization services. So it means it's comprehensive. It looks at all the elements of health systems, and that is an enabler for us to deliver vaccines to the population of Nigeria. Now, not just children, but adults, because have interventions on the vaccines that address the conditions of adults as well as children. Thank you.
Okay, now you talked about adult. I'm interested in that. When you said adult, talk to us. What kind of vaccines are you talking about when you talk about the adult vaccine?
So I'll start from, if I go to the adolescents. In the program and priorities, as we saw in the last HSS2, we have some introduction of new vaccines, including what we call a human papilloma virus vaccine, HPV, that addresses cervical cancer, and it was targeted to adolescents and young people. So, and we now have vaccines equally supported by the grant, like for yellow fever. And those are vaccines directed not just to children, but to a population beyond under 5, including young people and adults.
Okay, now to you, Chika, you are the CSO. Now talk to us how this affects you, the Gavi Health System Strengthening Grants.
I'm really excited about this, because our coverage so far documented is 53% coverage, and we're looking to get to 87, or between 84 and 7% coverage. And in these HSS grants, there's an intentional, deliberate inclusion of CSOs in this funding. 10% of this funding goes to CSOs. To do what? CSOs to hold, like when we had the conversation with the Honorable Minister of Health, Professor Patti, he says it's going to be a mutual accountability. CSOs bring CSOs to the table to add their voice at that time, at their time, so that at the end of the day, we have a mutual accountability. So this grant is going to go into advocacy from CSOs and also accountability. So at the end of the day, all hands really are on deck. Because the money the 10% for CSOs, it means that we have our job cut out for us. We have been included in this. So that means failure or success, CSOs will also be there. So that is why, for us, the fight against diseases is fight to finish.
Okay, now back to you, Dr. Emedo. Before the program started, we were saying something about the Gavi, and of course we also talked about, you said about $193 million within the period of 4 years, like we rightly mentioned. Now, what are the target, who are you targeting in terms of this funding? What are the areas we are looking at affecting with this funding?
As you said, the program is, as you said, is around strengthening our systems as an enabler for delivering vaccines and immunization to the population of Nigeria. And the target we are looking at are people from under 5 at birth and adult population as well as adolescents. So it's well encompassing in the populations we are looking to support, to prevent. As you all know, we always say prevention is better than cure. But the biggest prevention tool for diseases you have is vaccines, because it has a wider coverage for people and interventions you want to prevent and you want to take care of. So that's basically what we are looking at. So we say all population strata of Nigeria will benefit. But more importantly, we are very much interested in protecting the children and making them survive.
Okay, still on you, Dr. Emedo, what impact will this have on our primary health care system? Because this is, if you talk about, immunization and vaccines, these are the areas where, people really, the locals, people at the rural areas make use of the primary health care system. This way to reach them. So what impact will it have?
So, thank you very much again. In the primary health care system, the purpose and the impact we try to achieve is to reduction of mortality, deaths. And the population that's most at risk in Nigeria is the population of children under 5. And those are the people we prioritize and target with vaccination programs to be sure that you are protected from the child killer diseases. That's the first thing. So what the impact we're looking at is reduction in under 5 mortality. Then there is there's intervention targeted to adults, especially mothers and pregnant women, to be sure that they get essential services that enable them survive the whole gamut of things we go through during pregnancy and delivery. And that's what we do with primary care systems. And within that, we mean our systems are strengthened enough to be robust enough to deliver basic services, not just immunization, but basic services including antenatal care, delivery care, postnatal care for the mothers as well as the newborns. So it's a system-wide support to Nigeria, which in no means is a small thing. It is very massive. We've seen experiences in the last cycles of the Gavi support in Nigeria that this is feasible, is doable, we can save lives, we can using system support interventions to improve and create resilient systems that will enable us to deliver health interventions for the entire population of Nigeria.
Yeah. Okay. Now to you, Chick, you wanted to add something?
Yes, I wanted to add something.
Okay.
To say that the most important thing is that lives are saved. Gavi so far has added 9 new vaccines into the immunization system. That is to make more lives to be saved. Right now we have 2.3 million zero-dose children, and then we also have high mortality of both children and their mothers, and generally. So this particular grant is to make sure the evidence that we have is to make sure that lives are saved is the data. So now, once we say 2.3 million zero dose has reduced to no zero dose, then we know that it's working. Once we say that nearly 8 million children that need vaccines have received their vaccines, then we know it's working. So the good part of this is that data cannot lie. And that's why this HSS3, we are watching.
Now, I like that word, we are watching. Now that brings me to my next question. How do we ensure that these funds, there's a transparency, accountability in the utilization of these funds?
Okay, the good part of this particular set is the transparency, the inclusion of the stakeholders. No, I don't like to use those words. The inclusion of all of us, you know. Now we have included CSOs, we have included private sector. Everybody is in the room. The government, donors, everybody has a hand in this. So even in that shows that there's a plan for success, in my own opinion. Everybody, based on the experiences that they had in the previous HSS2, they have pulled out from that experience, and now they have HSS3, and you have all the stakeholders in the room. That is very, very important. Then secondly, not only in the planning, in the designing of everything that has been happening so far, everybody has been in the room. I think for me, that is one sure sign of success. And then the fact that the accountability systems are not just developed by government, it's a mutual accountability system. We all agree that this is the road that we need to follow. So when you look at all those things put together, you realize that there is the success if we follow everything we have planned. You know, if we make sure that we hold each other accountable, if the people that make a lot of noise are CSOs like us, you have brought us in the room, you know that we are noisemakers. We make noise, we say it as it is. That means it must succeed. Because before it starts to spoil, we start to talk, we start to ask, we start to push. Definitely. I'm very excited and I'm very optimistic that this HSS3 is looking at 84% coverage, yes? We're going to get more than 84% coverage. Because now, CSOs are in the room.
Thank you very much. CSOs are watching and they're in the room. So we'll take a short break now. The conversation will continue after the break. Don't go away.
Of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today.
Welcome back. In case you're just joining us, this is Nigeria Today, and we're looking at strengthening our healthcare system in Nigeria. And of course, I have a gentleman here in the studio and a lady. Now, Dr. Embedo, we've had the HSS2, and now we are heading to the HSS3. Can you give us the assessment of what the HSS2, how successful it has been?
So HSS2 is a very successful intervention we've been able to pull out in Nigeria. And I'll start from the point of the success point.
You know, when we are saying the HSS, so in case for the viewer, health system strengthening
the
grant, right?
Grant.
Yes,
okay.
grant.
The first thing you could count, as Chika started saying, success is partnership we're able to build across the players, across the stakeholders. And within that is the primary within that is the government of Nigeria being under driving seat leadership around our ability to prioritize and invest and implement primary care interventions targeted at the population, driven through our entry point, which is immunization. And you call Nigeria is a very plural nation. With Mark says, we always say we have 36 nations in the country. One of the big successes is that we were able to pull within HSS the leadership support from the subnational level, where the state governors in its priority state we had identified to test the HSS program, and we had driven results. It's very intensive result in those processes. So the health systems are strengthened, but in the direct report we've seen that we're able to even reach out to populations that we feel are very important. It is important to note that in HSS2, we are able to vaccinate 1.7 million zero-dose children across Nigeria. And we are able to reach 91 million population of Nigerians with measles vaccine, and then we do 85 million Nigerians with yellow fever vaccine. I wanted to pick some very big elements of the result. We were able to succeed. But to enable that, we had investment in health workforce, we had investment in governance and leadership, with equally co-investment with states. We, more importantly, our ability to deliver vaccines were strengthened enormously with expansion of our cold chain capacity, storage capacity, by about over 10 times in HSS2. And we had co-creation, co-investment with states, resulting in the recruitment and absorption of about 3,680 health workers on the grant that the grant invested and recruited as frontline health workers that enables us to reach out to reach this population. And the success of it is that the state government and these states we invested in, these states being Bayelsa, Gombe, Jigawa, Katsina, Kebbi, Niger, Taraba, and Zamfara states, they invested their own resources to complement the resources coming from Gavi. It means that the states and Nigeria are seeing the value in investing in health. The governors in this state saw the value in investing in health. And we can look at it, looking at the numbers again, to see that we have tremendously reached out to the underserved populations. We have tremendously improved coverage with essential vaccines, vaccination against major killer diseases of our children. So it's very, very tangible. I will start with say one of the major areas is around leadership, the partnership we're able to do, the co-creations done with the states, the investment of states, and the operationalization of services, improving accountability and mechanisms to be sure that we deliver these monies we are talking about amounted to delivery of services, vaccination to the last mile, to the last child in the country.
Now, Chika, I like asking you this part because I know you'll be the best person to answer this part. At the end of the day, these vaccines should get to those that need them. Now, how can we ensure that the ordinary man or the ordinary woman, the ordinary child in this case, have access to these vaccines? Because we've seen situations in the past where even health workers, want to cut corners, want to ensure that they get something. Because this is a grant, and I want to assume that these vaccines will be given, maybe some of them for free, to these children. So how can we ensure that people get this vaccine for free so that we achieve the aim, the goal that we set to achieve?
And that's a very good question. The thing I want to say now is that many of these vaccines are free.
All the vaccines.
For the under 5s, they are free.
All of them?
All for the under 5s are free.
Good.
The vaccines are free. So by virtue of the fact that it is free, it is no longer interesting to sell.
So when you say the vaccines, I would love you to mention some of
so,
these
vaccines.
Like the
BCG,
okay.
BCG, Penta, measles, yellow fever, malaria, Rota, HPV, Mpox. Remind me here. I think I've captured some of them. Yes. All these vaccines I'm telling you are free. The beauty of it being free is that you can't sell it. What is free, you can't suddenly start to sell. Nobody will buy. So, and that is the beauty of that. But the challenge is how to create demand in such a way that those that need the vaccines actually trust the vaccines and go to collect the vaccine. Because the most important thing is it must get to the hand before you can call it a success. Let me tell you a story. My mother, I lost my mom in 1995 to cervical cancer. So my passion now is not because of any other thing other than I saw her go through the whole pain process. I would not wish it on my enemy. And at the time that happened, the vaccines were not available. It cost me a lot of money to be able to say this, to see a psychiatrist, to be able to talk about this as I'm talking about it today. So for me, vaccines are miracles. And all hands must be on deck to make sure that vaccines get to everyone. It is not a joke. Now that the HPV vaccines are around and it's free, CSOs are there, private sector, media. Let us start to ask the questions. Let's follow the money. Let's follow how these vaccines work. Let's support in creating demand. Let's advocate for vaccines. Let's support domestic resource mobilizations for the purchase of these vaccines. Nearly 8 million, 7-point-something million children need routine vaccines on a yearly basis in this country. Let's make sure that there's no stock out. Let's make sure that the government brings out their own portion, their domestic resource to support the Gavi counterpart funding to purchase all the vaccines that are necessary. Let us start shouting it. Let us start talking about it. Let's make sure that the states themselves make sure that the logistics that is necessary, the funds necessary, the line item in their budget to make sure that vaccines from their state to the primary health care is provided. Not that because at the national, it's the national that provides vaccines to the states. But now it's the state that's supposed to provide the logistics from the state itself to the PHC. Let us make sure that we ask these questions. We ask these governors. We ask these commissioners because it is key. We don't want to waste the vaccines. We want the vaccines to get to all those that need them. It's a miracle. And I keep saying this. I pray for a day where every disease will be vaccine preventable.
Thank you. Now, Dr. Dr. Emmanuel, talk to us about okay, she mentioned it earlier about how safe these vaccines are, because a lot of times we've seen people say, no, I'm not taking this vaccine. No, they are here to kill us. As a matter of fact, they say spreading that information. Now, talk to the people about how safe these vaccines are. That's one. And secondly, how people would hold these institutions accountable, even the health workers, how they can ensure that it belongs to them, because now it's for Nigerians. The vaccines are for Nigerians. How can we as Nigerians hold these people accountable and ensure that we get the benefit of this grant?
So, thank you once again. I'm happy to talk about how safe vaccines are. The vaccines we deploy in Nigeria are very safe. All the vaccines we have go through the rigors of testing, production to the point it gets to Nigeria. And is happy to see that the national agency that's responsible for regulation of drugs and the food, that's NAFDAC, they are involved in the certification tests and proof that these vaccines are safe for the citizens. And I would, in the second part of your question, talks about how we are being accountable to the lowest level. As we've heard from the CSO group, the first thing is that there's a broad engagement of stakeholders. Just beyond this, CSOs represent the people, the populations that we are serving. But more importantly, we've seen that in Nigeria, we can't deliver vaccines without bringing the stakeholders at the community levels, the gatekeepers at the community, traditional institutions, regional institutions to play. And I'm happy that even in today's meeting at the launch, we had stakeholders at the meeting to add their voice to creating that demand, creating that accountability.
And say they'll pass information to the rest of the people. Yeah. Thank you very much.
More importantly, from what we've experienced in HSS2, where the traditional institutions, religious institutions, played vital role to ask accountability for delivery of vaccines. What is in the vaccines? How do you mobilize? How do we own it? How do we benefit best from it?
Thank you.
Show to the success we had.
Thank you so much. Dr. Emmanuel is a health specialist UNICEF Nigeria. Thank you so much for coming on the program and sharing your thoughts with us. And also we have Chika Kemiofo from the Vaccine Network, a civil society organization. Thank you so much.
Thank you
For coming on the program. And that's it on Nigeria Today. I'm Mikaria Clinton. Goodbye.